Hello, I'm Alan Van Zandt at the University of Kansas Health System. I host a news and information program we show internally to our employees 3 times a week here. It's called Take 10. We explore topics, talk with people who make our health system run, and cover the latest happenings across our campuses. Today, just an example of sorts of what we do here, as we're here to interview 2 of our caregivers featured on this virtual career day hosted by the Kansas Health Association. So joining us today, Angela Zuberi. You are a surgical technologist, correct?
I am, correct.
Thanks for being here today. Also, Jeremy Thompson. Yeah, you are a sterile processor.
That is correct, yes.
I will start with you. What does a sterile processor do?
So sterile processing, just a very generalization of it, is we reprocess the surgical instrumentation that is used in procedures on the various patients throughout our health system.
And so in reprocessing, these are after they have been used in an OR.
That is correct.
You do all the cleaning and the sterilizing and everything to make sure that they are safe to be used once again.
That is correct, yes. So they will come down to us very gunked up with various forms of blood and tissue, all that fun stuff is on there. And then afterwards we get it all cleaned off, send it through our gigantic washers that we have so that we can send it over to our assembly side where we will reassemble those sets and get them ready for sterilization. So
that blood and gunk you are talking about is why I'm in a studio instead of out there with you all. Angela, a surgical technologist. Tell me about your job.
Well, once those instruments come up, we are actually getting ready to prepare for surgery. We're setting up the sterile field, and then once the patient rolls on in, we're working hands on hands with the surgeon, giving them what they need, just being there.
Scalpel?
Scalpel.
That just like that. All right, we're good to go. Don't trust me with a scalpel. Trust me.
Watch out for those sharp.
I didn't probably hurt myself as much as anyone else. So, what kind of training did you need to get into sterile processing?
So, sterile processing, as it's developed and grown more and become more complex, I actually ended up taking a course for it. I know here at the University of Kansas Health System, we do offer an internship to help learn the sterile processing field. So, in regards to that, I actually took a course and ended up getting certified through HSPA, where I currently hold all 4 of their certifications as of right now.
Angela, what kind of training did you have?
I actually went through Penn Valley to get my surgical tech degree, and it was like a hop, skip, and a jump, honestly. Just did some clinicals here, honestly, and it was great, and I just love the experience. So
Well, both of you are in fields where we need good, qualified employees of the future, and so certainly both of you can speak to your professions as well. What are challenges that you face?
Some challenges I feel with sterile processing is just having enough adequate equipment to get to the surgeons and to the scrub techs. There are just times where, we're trying to get the instrumentation turned over as quickly as possible, but also as safely as possible. We don't want to have a situation where we're putting patients at risk. So I think our biggest hurdle, at least for me, is just making sure that I have enough equipment for our scrub techs to make sure they can do what they need to do for our surgeons.
So you are in there in the operating room when a procedure is going on. What kind of stress and challenges do you face? My goodness.
Yes, anything can honestly happen at any given moment, so you have to be on high alert. Just kind of your ear, you have to have a good listening ear, paying attention to your surroundings and what's going on, at the field, anesthesia too, just all the things.
Well, we talked about the challenges, but you both love your jobs. I already feel it so much from both of you. Why? What is it about your job that you enjoy so much?
I love that every day is not the same. I love that I'll come into work and I might be doing the same basic things, but at the end of the day, it's always something new. It's always something different. I'm not working on the same instrument sets I worked on the day before. I'm not always going to be on assembly. Sometimes I'm overworking with that gunk over in our Deacon Tam side where we get all of that lovely instrumentation from the OR. Some days I'm working on the sterilizer and I'm actually sterilizing this equipment and getting it prepared to be sent up for storage. So it's the variety that I get each day, and it helps me, keep myself going each time that I get into it and learning the new situations and the instruments every day. I just love finding everything else about it.
You both have to have a lot of personal satisfaction in what you do, in the care we provide our patients, and the safety and the high quality. And maybe I stole your thunder a little bit, but what else do you like?
You are so fine. Steal away. Just kidding. I actually love working as a team, working with the surgeons, working with my nurse. Just we come together as a team. That's my favorite thing. Teamwork makes the dream work.
Well, it certainly does. We hear about these great jobs you have. are students out there listening, maybe they want to enter your field. What kind of advice would you have for them about someone that wants to get into sterile processing?
I would say just take your time to know your instruments and give yourself enough grace to be able to say, okay, I don't know it now, but I will know it.
Well, what about you?
If you don't mind being on your feet all day, it's a great thing. Stressful situations, like I said, anything can happen at any given moment, so you have to be on high alert all the time. But it's a great field to be in. Honestly, you see surgeries, you're in there, you're taking care of the patient one-on-one, you're behind the scenes.
Well, you both have been fantastic to talk to, as I have learned a lot more about what you each do. Angela Zubiri, you made me test your name one more time. Did I hit it?
You got it.
I did it. Jeremy Thompson, sterile processing surgical technician, thank you so much for us learning more about what you do. Also, thank you as well for joining us, to you students joining the Kansas Hospital Association's Virtual Career Day. Best of luck to you all.